Hey everyone, Dr. Derek Rose here to tell you a little bit about a question that we get a lot here in our office, and is that whether heat or ice is better for a particular pain or problem. So when we talk about this, a lot of times people will say, well, heat really feels the best, and especially in wintertime, like when we're filming this, heat often is the people's go-to. But what does the research really say? Well, it talks a lot about the best one really being which one feels the best for you. But a lot of times people want a little bit more guidance, and so there are some guidelines that we can follow. When it comes to heat versus ice, a lot of times we focus on ice for those injuries that are more in that 24 to 48 hour window or newer problems. And the reason that we do that is because ice tends to be a little bit better at lowering the level of inflammation, as well as helping reduce the amount of pain that a particular person has. Here in the office, we utilize heat a fair bit more just because we're trying to loosen up muscles and get those joints nice and loose so that when we go to adjust, it's a little bit easier. But heat is really good more for the chronic problems, more of your arthritic conditions, and more of those things that have been more based around stiffness rather than true pain. And so when you are trying to decide whether or not to use ice or heat for a particular problem, try both. You can even alternate. Try 15 minutes of one, waiting a few hours, 15 minutes of the other. Or you can do a more day-by-day approach and really focus heat in the morning when you tend to be most stiff and ice in the evening when you tend to be more sore and in pain. So those are some just really quick guidelines about whether or not to use ice or heat. And if you have any questions, please call our office. Thanks.